Okay, welcome. Today we're going to be talking about finding balance as a dentist, navigating all the challenges that exist. It's like a maze. It's not as straightforward as you might think. So let's get started. Again, my name's Scott Cairns. I'm a dentist, and the reason I do this is I want to enhance the lives and the livelihoods of all the general dentists who choose to work with me so that they may best serve their patients and themselves. Let's get started. Okay, so first, what kind of people become dentists and why does it matter? On average, the entering dentist into dental school is 24 years old. In 2021, 56% were female, a variety of ethnicities. Average debt after they graduate from dental school is over $300,000. And there's approximately 7,000 new dentists per year that are graduating and getting licenses, and that number is growing. So, what are characteristics of these dentists? Well, first, they're smart. So, dental schools act as a filter for a baseline of intelligence for the workforce of dentists. In order to get into dental school, they had to do well in college and do well on a standardized test. So all dentists have a baseline intelligence, which is higher than probably the average intelligence. So they're smart people. They're I think the nature of the preciseness of dentistry attracts a certain perfectionist personality. And of course, it's a helping profession. So there's passion towards service, and that would be expressed through greater empathy and compassion towards their fellow human beings. Also, a lot of dentists, not all of them, but a lot of dentists are people pleasers. So people pleasers are people that do something that they don't agree with necessarily, or they apologize for doing what they have to do. They have a difficulty in saying no. It's easier for that type of a person, a people pleaser, to sacrifice their own values than to upset another person. So people pleasers become kind of like chameleons. They're changing themselves in order to make others happy. And this actually can be a problem in dentistry. And then I also think that most dentists go into dentistry desiring to have security and above average quality of life. So the training of dentists is an important consideration as well. So dentistry is a technical field, but it's also a profession. And the ethics of dentistry, they teach it throughout the course of becoming a dentist. So first is the do no harm, the non-maleficence. They also teach beneficence, which is do good or training. Our training instills a tolerance that's in the micron level. It's smaller than millimeters, right? And that gets dentists thinking about, again, that perfectionism and how they are going to achieve perfectionism. They become very good at what they do. Also taught is a sense of justice or fairness in the dealings with the public, and then a thoroughness to look at everything, and then on top of looking at everything, to make the right call. So what are the challenges? Well, the cost of the dental education is a huge challenge to finding balance, right? So that's what we're talking about here, is balance. So there's the actual cost, the over $300,000 of debt that the most dentists have from their education. And then there's the opportunity cost. So 4 years for a smart person, we kind of clarified that these people are smart. You have to take that out of their future earnings as well, or all the time that they spend in school when they could have been in the workforce. This is a huge investment that these people are making in order to become dentists. Another one of the challenges is something called patient ambivalence. So this has always been present. Um, this is not new. The cost has changed, but patient ambivalence has not. This ambivalence towards dentistry leads to frustration, and it's underappreciated in the learning environment because in school it's not a real situation. So this can be overcome, but it takes a great deal of time. And all the time spent in the dental office, the dentist must be accounted for financially. So the patients come in not really thinking much about dentistry, and we have to make them aware and get them to the point where they actually are concerned enough to want to do dentistry. That takes time. Patient fear, another thing that's always kind of existed with dentistry, is, it's an unknown for the patient. They're not in control, and there's an element of pain that can be associated with dentistry, and that creates anxiety. So this forces, or not forces, but it results in a stressful work environment that takes a toll on providers, and along with the ergonomics of dentistry, there can be some pain. So the psychological toll, the physical exertion of being a dentist, does limit the amount of hours that a dentist can work in a week and over a career. And then there are the market forces. So unfortunately, dentistry is no longer a true free market because the fees are not controlled by dentists or by the small business owners. The fees are controlled by third-party payers in the United States. So let's talk about So, what do we do about all this? How do we thread this needle? Like, how do we get to a balance? So, you know, the dentist has this concern, financial sensitivity, overall the cost as opposed to the benefit over time. They need to change their mindset around the benefit as opposed to the cost. So, an example, we can regrow enamel with that Curodont technology, $125 approximately for, an application. And that may seem like a lot because that's not covered by insurance. But if we take that, enamel lesion that has just reached the dentin and we can reverse it, and we can stop the cascade of events of that tooth needing a filling, and then when that filling fails, needing a crown, and if that were to fail, needing a root canal, and root canals don't last forever, so then eventually it needs to be extracted and have an implant placed. Now we have a tooth that we have prevented the expense of tens of thousands of dollars over time, or perhaps $10,000 over time, for something as short-term perceived as expensive, $125. That's a huge benefit for the patient. Another example would be a patient who goes on a preventative periodontal maintenance therapy. So they go from scaling and replaning, and they're coming in 4 times a year to have their periodontal condition maintained, and they don't progress. As opposed to the person who doesn't want to spend the money on it, or the dentist who doesn't want to talk about it, and the patient just progressively continues to get worse, and they start to slowly lose teeth, and then also at the same time slowly lose trust in dentistry. They get frustrated, they get burnt out on dentistry, and then they end up having to have all their teeth replaced. And in order to get to the same level of function that the person who had maintained their teeth, they would have to go through implants and an all-on-X procedure or something like that. Again, literally tens of thousands of dollars more expensive to go that route than it would be to just maintain what they have. We can go on talking about, if you did a crown on a cracked tooth as opposed to waiting for it to break and then it needing a root canal or an extraction and an implant or something like that. It goes on and on. So there's another consideration for the dentist, and that would be the comprehensive care versus limited care. So addressing all concerns now versus addressing some of the concerns now ultimately is the patient's decision. Patients have autonomy over their healthcare choices, but we have a responsibility to enlighten them and let them know that there are so many different things that are going on that could be taken care of now when they're smaller before they become bigger problems. Treatment planning is oftentimes time dependent, right? We have an obligation, if we see a pathology, to inform the patient of it, make them aware, and tell them the consequences of that treatment, of that condition left untreated. The patient gets to choose what they want to do about it. It's okay to talk about choices, but don't make the choice just about price. They have to make the choice about what's in their best interest. And then the quality of the care versus the cost of the care. So we want to do what's best for the patients, but patients need to choose what's best for them. If a patient chooses an inferior option, that's okay, but we don't have to own what they chose. Meaning, if they chose to do a filling and the filling breaks down after 3 years, even though we didn't think a filling was appropriate, that's on the patient. They made that choice unless we didn't advocate for the patient to do something better. So is an inlay better than a composite or an amalgam? Undoubtedly it is. If they want the composite, they need, you know, the best possible composite they can get at the fee that you're able to collect for that procedure. So if the fee is really low, they don't necessarily deserve to have the most capable set of hands doing that procedure. That could be like in the state of Colorado, that could be an expanded duty dental assistant that places the composite. That's part of what they're actually paying for. If you think that they need a crown, but they can't do a crown for now for some financial reason, or they just don't want to, then maybe what you do is you call it a buildup, knowing that a buildup is designed to support the crown in the future when that person does it. And if they do it quickly enough, then maybe the buildup doesn't need to be replaced. So third parties place limitations on dentists, and they have, you know, rules about materials or an approach. They'll say they're not making clinical decisions, but rather they're not going to pay for them. I think that it's unethical for them to stipulate patient care. So for them to say that they can't have a bone graft is one thing versus saying that they won't pay for one. So in Colorado, there was a Senate Bill 17190 that allows dentists to transfer the cost of zero-pay procedures, meaning the insurance company doesn't cover it, to the patient up to their usual and customary rate. So if a dentist, or if the patient wants, you know, the bone graft and bone grafting procedure done with the extraction, then they have to pay for it. And it goes back to, on the economics of dentistry, that is arguably better dentistry than leaving it as an empty hole to fill in. So that would be a way of taking the approach of increasing what you're charging for your patient's care. And then it's also not fair, in my estimation, that, you know, if a patient wants something, they should be allowed to get it and choose who does it. So the example here would be like, say, someone like Elon Musk, right, billionaire, comes in and has PPO insurance and wants to get 6 crowns on his front teeth that are not elective, you know, broken down composites. They need crowns. It would be justifiable. But he says to the doctor, I want to use the absolute best ceramist in the country to do that. So, you know, you do research and you find a lab technician who does wonderful work and it's $1,000 a unit. But your insurance company is only going to allow you to charge $900 per tooth. Well, that's not fair. That should be, you know, that patient's autonomy is being stripped by going to an in-network dentist in this situation. So there should be a way for that to be allowed. So in closing, balance is a verb. It's not a destination. It's not something that you set up everything right and then it's always there. It's like surfing. It's like finding how to continually stay in an upright position when the environment is changing. Because in dentistry, the people are changing, you know, how much time things take for each procedure based on the patient's, you know, how easy they are to work on and what their fear level is and how long it takes them to come to an awareness of their condition and become concerned enough to do it. And then for you to get back the reward for the investment that you made into becoming a dentist takes time. So I bring all of this up really just to pique your interest and your curiosity about it, and to be open to the idea that you have to make decisions with your patient that are in their best interest, and how are you going to do that? You can't have just a rote way of doing things. So, hope you have a great day. Thanks for listening.